Hi, this is a brief presentation on peroxisomal disorders, and again, this is to go with the biochemical material, but this genetic material is primarily going to have to do with the genetic causes and the clinical manifestations. So, peroxisomal disorders describe the function of a peroxisome, list peroxisomal disorders, describe the clinical complications of adrenoleukodystrophy, Zellweger syndrome, including age of onset, and recognize evidence of demyelination in MRI findings of peroxisomal disorders. So, peroxisomes are intercellular organelles. So here is the peroxisome over here, and here's our mitochondria, here's our endoplasmic reticulum. We talked about lysosomes as well. Here's our mitochondria. These are all organelles inside the cell. But the peroxisomes have a specific job. Unlike mitochondria, they do not have nucleic acid. They do not have their own DNA. And their job is to break down very long-chain fatty acids into smaller pieces that can be used in the mitochondria, basically. They also synthesize a chemical known as a plasmalogen that's important in brain and heart function. So disorders resulting from abnormalities in peroxisomes include X-linked adrenoleukodystrophy, Zellweger syndrome, and Refson's disease. X-linked adrenoleukodystrophy usually is a childhood onset disorder. 35% are cerebral. Adrenal myoneuropathy, or AML, is 50%, and then Addison's disease, which is more of an adult onset, 15%. So the same gene, different changes can result in different outcomes at different ages. So, the gene for X-linked adrenoleukodystrophy, surprise, surprise, ALD, is on the X chromosome. But 20% of female, what we call carriers, can develop spastic parapresis in middle age. And that has to do with X inactivation. So many, we used to think, females are off the hook if they have an X-linked disorder. But again, a female is a mosaic. So if the wrong cells have X, that X that's inactivated is the normal X, and the one on is the one not making this enzyme it has to do in the brain, it can result in some issues. So X-linked adrenoleukodystrophy is caused by mutation of the ABCD1 gene. So maybe that's easy to remember. This gene codes for an enzyme, ALDP, which transports fats and very long-chain fatty acids into the peroxisome to be broken down. So the peroxisomes are there, and it transports these fats inside. Without this enzyme, you can't get it inside to break it down. What happens if we're not bringing it down? Well, too many long-chain fatty acids result in demyelination. And myelin, as we recall, is kind of that coating, just like an electrical cord, around neurons to make them transport signals efficiently. Adrenal insufficiency results from damage to the adrenal glands caused by the inability to produce the amount of steroid hormones. So this elevated of very long-chain fatty acids also causes adrenal insufficiency. So the cerebral form, ALD, in this infantile form occurs, usually presents around 3 to 4 years of age. Onset, or starts showing signs 3 to 4, but onset 4 to 8. Initial early signs include worsening of school performance. For instance, they used to know all their letters and their numbers, and now they don't. Auditory discrimination, and also visual disturbance. I remember as a resident, a child presented who had come from a foreign country into the emergency room with new onset blindness and deafness, and we eventually diagnosed this child with adrenoleukodystrophy, which was very sad. MRI shows enhanced T4 signaling, and this is just another sign of demyelination. Treatment. A bone marrow transplant during infancy prior to symptoms, this results in bone marrow cells that can get all around the body with a normal ALD gene and prevents the accumulation of very long-chain fatty acids in the peroxisomes and really is curative. Corticosteroid replacement can help the adrenal system but has no effect on the nervous system. And there's something called Lorenzo's oil that's a very high-fat oil that, was believed to be a great treatment, but really it's still considered experimental. And finally, new therapies, including CRISPR, which puts the right gene in, is being performed on an experimental basis. Illinois, as well as many other states, has added X-linked adrenoleukodystrophy into the newborn screen, so we can identify these babies at 2 or 3 weeks of age. We can get them into a transplant, and the transplant really is the treatment. So the earlier we can find these kids, before the brain is being damaged, we have about a year. So if we can get them in infancy, the outcome is actually pretty good. So that's actually the reason it's been put onto the newborn screen. Again, it's not in all states, but treatments for this is tried to replace the gene, either by doing a bone marrow transplant, and eventually it'll probably be CRISPR, prior to the symptoms occurring. So adrenal myeloneuropathy, or AML, is a milder form caused by this ABCD1 gene. It usually presents in the 20s. So remember, we used to think all or none. None is adrenoleukodystrophy. Some is adrenal myeloneuropathy, or AML. Progressive ataxia, leg stiffness, sexual dysfunction, impaired adrenal cortical function. They can present slowly over years, and symptoms are usually limited to the spinal cord and peripheral nerves, slow progression of injury to myelin and axons. And then finally, Addison's disease. This is probably the mildest form of a mutation of the ABCD1 gene. The adrenocortical insufficiency presents between 2 years in an adult. A neurologic disability usually develops in middle age, and there's elevation of very long chain fatty acids. And one of the key characteristics is this hyperpigmentation here. Refsum disease is another peroxisomal disorder, a neurocutaneous syndrome characterized by rash, polyneuropathy, retinitis pigmentosa, deafness, and cerebral dysfunction. And it results in the accumulation of phytanic acid in the plasma and tissues, and it's a deficiency of the phytanyl-CoA hydroxylase, which is a peroxisomal enzyme. It's inherited in autosomal recessive. And then finally, Zellweger's. Of all the peroxisomal disorders, Zellweger's is the most severe. Fortunately, it's very rare. And clinical features include dysmorphic facial features. And I just want to point this out. This face is really long. The fontanelle actually opened to almost the bridge of the nose here. And you can just see the way this baby is like lying there, that they have very low muscle tone. And one of the things is seizures in the first 24 hours of life. X-rays can show stippled epiphyses. Death usually by 6 to 12 months. And unlike the other disorders where the peroxisomes aren't working right, there are no peroxisomes. So peroxisomes also make these things called plasmalogens, if you recall, and so nothing is being made. So if you look on EM, there's no peroxisomes. Elevation of very long chain fatty acids are identified, and again, it's autosomal recessive, and genetic testing can be performed. So here is a USMLE question. A 4-year-old male presents to the ER with a new onset blindness and hearing loss. On MRI, the brain shows demyelination of the parietal occipital region. He is noted to have elevated, very long chain fatty acids. What is the disorder? Refsum, Zellweger's, X-linked adrenoleukodystrophy, or Gaucher. And the correct answer is X-linked adrenoleukodystrophy. He's 4 years old. That's a common age of presentation. Zellweger's would present earlier, Refsum later, and Gaucher is a lysosomal storage disease. So that concludes this presentation.